Dr. Grill, thanks for being here.
My pleasure.
We've been talking about this, I think, especially after the tragic deaths of 3 children in Ottawa and Eastern Ontario. I want to ask you, though, at your hospital in particular, what are you seeing when it comes to the flu, when it comes to hospital admissions, and especially the number of young people that are sick right now?
Yeah, let me start by saying that my heart goes out to the families of those children in Eastern Ontario. We never want to hear about deaths related to influenza, although unfortunately every year there are tragedies. There's over 3,500 people that die of influenza every year. We're seeing a lot of cases at our hospital. You know, the pediatric unit was quite busy recently, and in our family practices, lots of my colleagues and myself included are seeing lots of people with respiratory illness. And based on the data, the surveillance data from Public Health Ontario, the majority of what we're seeing is influenza. You know, about 25% of the cases that we test are coming back positive, compared to less than 5% with other viruses like COVID and RSV right now. So lots of sick people. And you're right, we're seeing a lot of cases right now in children and adolescents. It seems like when you talk to your friends, everybody seems to be getting sick or they're missing school, et cetera. But lots of hospitalizations, lots of outbreaks in long-term care facilities, you know, serious infection, and we have to give people advice on how to prevent getting sick.
And now, again, we're in respiratory season, and clearly, I want to get to that advice here in just a second, too. We're in respiratory virus season. We know that it's there, whether it's RSV. The flu clearly is clearly affecting, you know, most of the population right now. This is earlier than expected, though. We're not usually talking about, you know, flu numbers this high ahead of Christmas and the holiday season, right?
Correct, yeah. So right now, the number of cases that we're seeing this time of year is higher compared to data that we have from the last 3 years. And again, that's specifically Ontario data, but it can be related to across the country. You know, why we're seeing that? Every year is a little bit different. We usually get predictions from our colleagues down south that tend to get the flu season before we do. But, you know, again, it's this time of year, lots of respiratory illness. And what I'm concerned about specifically for influenza is that we haven't hit the peak yet. So over the next 2 years, we're going to actually see more cases. And so people remain at high risk. And that's why they have to be concerned about it and know what's out there in the community.
And that is concerning, too. I want to ask you, especially when it comes to young people and advice for parents, is because, you know, we're saying if they have mild flu symptoms, it's best to stay home. We don't want to overwhelm ERs across, you know, the province and across the country. But I've also been reading, too, and would you touch on it, too, at the start, about those 3 young people that have tragically died. At what point, or what are some of the indicators that parents should be taking their kids into the emergency department because they are concerned about how severe the flu might be?
No, absolutely. Okay, so the first thing I'll say is that as a primary care provider, and whether you're a family doctor, nurse practitioner, pediatrician, et cetera, we are happy to see patients that are sick. So if patients are concerned about symptoms and they think that they have the flu, please make an appointment and come in. If you don't have a primary care provider, there's lots of other ways you can seek care. For instance, my hospital, Oak Valley Health, they have a community health clinic that's available for unattached patients in York Region. And Ontario Health has a list of virtual care clinics and clinics for kids across the province, specifically in Ontario, where people can go for care. But if you want to know specifically about the symptoms to look out for, you know, there's certain ones that are very worrisome where we recommend people go to the emergency department. That would be if somebody is having trouble breathing, chest pain, they're lethargic, which means you can't really wake them up, or they're suddenly confused. And specifically in kids for dehydration, if children stop feeding or if they have less wet diapers, those are medical emergencies, and people in our emergency department are happy to see those cases. So we don't want to give the message to just stay home and never seek care. But if you're concerned about your care, you've got primary care provider. If you've got those worrisome symptoms, you've got the emergency department. But if your symptoms are mild and you think you can just stay home, drink lots of fluids, get rest, you know, take Tylenol or Advil for fever, that's fine too. But please seek medical attention if needed. Our healthcare providers, my hat goes off to them. We are available to you, and we will be working through the holiday season to make sure everybody stays healthy and get the care that they require.
And I think I can speak on behalf of Canadians that we appreciate you and all of your colleagues who will continue to do that. Dr. Alan Grill, Chief of Family Medicine at Markham-Stouffville Hospital in Ontario. Thanks for your time today, Dr. Grill.
My pleasure. Last thing, it's not too late to get vaccinated. So please, if you haven't received your flu vaccine yet, they are free, they're available. Pharmacies, family physicians' offices, please get the vaccine.
Very true. Okay, thank you, sir.